I'm Kara, and I did my informative speech on SIDS, which is also known as Sudden Infant Death Syndrome. A lot of people aren't really aware of what SIDS is, but since I do work in childcare, I'm very educated on it. I had to take a few classes before I could even work in the classroom I work in, so I know quite a bit about it. So again, it's Sudden Infant Death Syndrome. It's the term used to describe the sudden death of a baby younger than 1 year. So a lot of the times under 1 year is unexplainable, and so a lot of times it is categorized as SIDS. Healthcare providers, law enforcement, and others investigate infant deaths to figure out what caused them. They do an autopsy, they examine the death scene, and they look at clinical history. They also will usually interview the parents as well and try to see if it was foreplay or not. If they cannot determine a cause of death for the baby, they would usually categorize it as SIDS. The history, Warren and Garrow laid out the findings that would later on be called SIDS. They just called it unexpected deaths in sleeping infants. At the time, it had reached 299 of those that could not be explained, and they categorized SIDS as 83.2 of those unexplained deaths. Some facts: about 3,000 sudden unexpected infant deaths occur in the United States every year. So that's about 1 in 3 are SIDS. Some other infant deaths that are common are suffocation, strangulation, entrapment, and wedging. A lot of children that sleep in the bed with their parents may be wedged between the bed and the wall, causing suffocation. A lot of the times, co-sleeping also, the parent may roll over on the child, which can cause strangulation. Certain factors and situations increase the risk for SIDS and other sleep-related infant deaths. So we're about to go over what can cause it or how to prevent it as well. So babies placed to sleep on their stomachs are at higher risk for SIDS. Babies that are born early are at higher risk. Getting regular medical care early in and throughout your pregnancy helps reduce the risk of SIDS. Smoking, drinking, alcohol use during pregnancy increases your risk for SIDS. Using fluffy blankets, bumpers, toys also increase your risk for SIDS and or suffocation. Babies who get overheated while they sleep are at higher risk for SIDS. Dressing a baby in too many layers of clothes or having too many bedding items in the crib is also a risk for SIDS. Babies who are fed breast milk are actually at a lower risk for SIDS. Vaccinated babies are at a lower risk, and babies who sleep with pacifiers are at a lower risk than babies who do not sleep with pacifiers. So the recommended sleeping position would be on the back, no blankets, no toys, nothing in the crib except for a fitted tight sheet. They don't even recommend a loose sheet. So a lot of people don't know this. They think, oh, my baby's cold, I'm gonna put a blanket in the crib with them. This is not recommended. Toys are not recommended. Putting a baby on their stomach when they cannot roll over is not recommended. If you put your baby on the back and they can roll over on their stomach, that's different. But putting them on their stomach is a higher risk for SIDS and suffocation. In conclusion, we can help prevent SIDS by doing these things, but there is not one known factor to 100% keep it from happening. So we can do all these things to prevent it and lessen our chance, but that doesn't mean 100% that it's not going to happen. But being educated on what causes SIDS or unsleep safe is the best way to help prevent it from happening to your baby. So they do offer some SIDS class you can take. I know a lot of people don't work in childcare, so they don't have the sources and the education that I have learned, but even they offer it for first-time parents, early parents, people who don't know. Also, if you do know about SIDS and you take a class of SIDS, there's actually some online resources that are available for anyone. Educate your friends. If you know someone who's pregnant, is about to have a baby, a new mom, a new dad, just let them know, like, maybe you should be doing this to help prevent SIDS. The ABCs of safe sleep: alone, on the back, and in a crib. So keeping your baby close to you while they were sleeping, but they need to be alone in a crib. Co-sleeping is very dangerous and is a big risk factor for SIDS. Always place your baby on their back to sleep, and your baby should sleep in a bare crib with a firm mattress and a tight fitted sheet. So a lot of people think, oh, I just put a sheet on it, but it's a very loose sheet, and the sheet can cause suffocation if they're able to grab it. And these are just my sources. So the Safe to Sleep NIH.gov, that was my main source for all my information. But I also got the picture from the last link, and then that second link I also used for quite a bit of information. So thank you for watching. I hope you feel a little bit more educated and you feel more compelled to do your own research. It's a very serious and also interesting topic just to know the do's and don'ts, and maybe we can help save lives together. Thank you.